Nursing Station. This module maintains the record of work done by a nurse. It can track that the job given by a doctor to a nurse is completed on time or not, and also track staff shift. Assign staff. Assign nursing station and patients to the specific staff member. Nursing station handover. Hand over the patients from one staff to another staff, due to duty or shift change. Point of care. It provides details of patient's routine, initial assessment, medicine advice, etc. Assign staff. Here you can assign nursing station and patients to the specific staff member. Search staff name by entering their name. This staff name is imported from Employee Master. You can add and manage staff name via Employee Master in Master module. Also manage Nursing Station in Nursing Station Master. Here we assign Nursing Station, first floor new, and 3 patients to Aarogya HMIS. Click on Aarogya HMIS. Then select Nursing Station. And click on Assign Patient. All patient of Nursing Station will show. Choose the patient which will assign to the staff. Save it to assign these 3 patients to staff Aarogya HMIS. Nursing Station handover. Hand over the patients from one staff to another staff, due to duty or shift change in Nursing Station. Click on Add button. Here we hand over the Nursing Station, from Aarogya HMIS to Ayush Gupta. So select from staff name, Aarogya HMIS. All patient which is assigned to this staff will auto-filled. Select a staff name. Enter remark. Save it. Now these 3 patients are assigned to Ayush Gupta. You can search the old records. Click on Print to print demo handover sheet. Point of care. Here nursing staff fill all the details of patient care, like routine, initial assessment, progress, instruction, medicine advice, etc. Select patient name. This patient is imported from IPD registration. Routine. Here you can fill the details of routine checkups, like BP, pulse, temperature, weight, etc. Save it. Initial assessment. It determines how unwell the patient is. Select case, enter remark. Save. Progress. Here you can fill the progress of patient. Save it. Instructions. Fill instructions given by doctor. Select instruction. Its frequency and duration. Save it. Investigation advice. Fill the investigation advice which is given to patient. Select investigation name. Enter requisition by name. Save it. Medical advice. Fill the medicine detail of patient. Select medicine name. Frequency. Dose, duration. Add one or more medicine name. Save it. Medicine requisition. Here you can fill medicine name, which is provided by hospital to the patient. Requisition by, select staff name. Medicine name. Requested quantity in unit. Add, and save. Now you can print investigation chart, medicine chart, initial assessment, and all assessment.